Hello everyone, I'm Dr. Patrick, and today we are diving into one of the most important topics for parents, caregivers, and even teachers. So this topic is the subtle sign of autism that many families overlook. Research from the World Health Organization and the CDC and even the American Academy of Pediatrics shows that early detection of autism spectrum disorder, this is ISD, can dramatically improve communication, learning, and sexual or social development. But the truth is, many signs are missed because they look like normal childhood behavior. So, in this video, I'm going to explain the 10 subtle early signs of autism that most parents don't recognize by using science, practical example, and evidence-based guidelines. So, let's start to see what is going on autism. The first subtle sign is the lack of shared attention. So shared attention means a baby or a child looks at something, then looks back at you to share the moment. So most toddlers look at the bed, then back at you. But many children with ISD don't check back, even when excited. So what parents miss? So you think the child is independent, you assume they are just focused, you think they don't like eye contact. This is a personality trait. Why it matters? WHO and the American Academy of Pediatrics consider lack of shared attention one of the strongest early indicators of autism, especially between 9 and 15 months. Example of behavior: child sees bubbles but never looks at you to share excitement. Child doesn't look where you point. Child avoid showing you toys. So subtle sign number 2, odd response to the name. Parents often think the child is stubborn, distracted, in their own word, or has a hearing problem. But when hearing tests are normal and the child still does not stand to the name consistently, research by the CDC shows this is very strong ISD marker. Example: child responds sometimes but ignores you other times. Responds more to sound like cartoons or jingles but not to verbal social cues. The subtle sign number 3, unusual eye contact. Children with ISD may avoid eye contact, give eye contact but in an unusual way, stare too long, look through people instead of at them. Many parents misinterpret this as shyness, tidiness, moodiness, but WHO guidelines emphasize eye contact abnormality as consistent early red flags across cultures. The subtle sign number 4 is the delayed or atypical gesture. Children usually communicate with gesture before talking. Example: pointing, waving, raising hands to be picked up, and giving objects to show interest. So in ISD, pointing is late or absent. Child reads your hand to objects instead of pointing. Gesture seen mechanically. American Academy of Pediatrics notes that gesture delay predicts later communication challenge. The subtle sign number 5, highly focused interest. This is one of the most missed signs. Kids with autism may fixate on spinning objects, focus on one toy, a part, wheel, button instead of playing normally. Line up objects instead of using them creatively. Memorize numbers, letters, symbols, unusually. Parents here often think the children is gifted very smart, or serious. But unusual intensity of focus is a core diagnostic feature in the DCM-5 criteria. The total sign number 6 is sensory difference. Many autistic children experience the world differently through their sense. Common subtle signs are covering ears at almost sound, extreme intensity to texture, refusing certain coughing, smelling or licking objects, spinning or watching spinning items, fear or fear of everyday noise like a blender. This is a problem. CDC shows sensory differences appear early but are often mistaken for quickly. Subtle sign number 7 is repetitive movements or behavior. Here, parents often dismiss this as cute habits. Examples: hand flapping, rocking, tiptoeing, finger flicking, and pacing in pattern. Important note here, this behavior increases when the child is excited or overwhelmed. This repetitive behavior are part of the DCM-5 diagnostic criteria. Subtle sign number 8 is difficult imitating action. Typically, children naturally copy clapping, waving, facial expression, pretend play scene, but in autism, imitation is delayed, copying play is difficult, and pretend play is limited. This is a major sign according to American Academy of Pediatric early screening guidelines. The subtle sign number 9 is language that sounds mechanically or scripted. Some children may speak early while others speak late, but the subtle sign is how they use language. Examples: repeating phrases from cartoon. This is called echolalia. Using adult-like formal language. Speaking in a monotone. Misusing pronoun "you want water" instead of "I want water." These communication signs are highlighted in WHO's Autism Spectrum Disorder fact sheet. Subtle sign number 10 is difficult with transition and routine challenge. Here, children may write down when routines change, insist on the same path, same food, same clothes, become anxious in a new environment. Parents often think this is stubbornness, being spoiled, or a behavior problem. But the CDC identifies rigidity with routines as a core ICD characteristic. As conclusion, those are the 10 subtle signs of autism most parents miss. Remember, having one or two signs does not mean a child has autism, but if several of these behaviors appear together, the best step is early evaluation. Early intervention is powerful. Children with ICD can thrive when supported early using evidence-based therapies. If you want more video on child development, pediatric warning signs, or early diagnosis strategies, make sure you subscribe to my YouTube channel. Thank you for watching and see you in the next video. Bye bye.